June is Acne Awareness Month. How about that? It's a condition that impacts millions of people throughout everywhere. These breakouts happen, and the guy that help you is Dr. Gregory Delost, right? He's here from Optima Dermatology with ways to avoid the common acne triggers. And it was fun watching you walk in today because I think 3 or 4 people stopped you and said, "How does this look? And what does this look like?" Is your life a lot like that?
Always, even like in the grocery store.
It's like, oh,
always on call.
Always got something going on.
Absolutely.
Well, almost everybody has experienced acne for one reason or another, but there are a lot of reasons that cause it. Is that right?
Absolutely. There's so many different triggers out there, and I think today we're going to talk about a few of the different triggers.
Okay, I remember you told me that you became a dermatologist because you did have acne problems as a kid.
I did. Growing up, I had a lot of acne problems. I tried and failed almost every treatment, and then went on Accutane, and it was life-changing for me. So it's a big reason why I got into what I do.
Yeah, so you really know how it affects people psychologically and physically.
Absolutely.
So what are some of the first ways? I guess, is it an age thing? How do you prevent it?
So it's really tough to prevent, but if we talk about some of the triggers, we could try to help control it. So like diet is a big deal, definitely in dermatology now, and we're getting more research showing that more Mediterranean-based diets could be really helpful for inflammatory skin disorders like acne. So the goal is to avoid foods that have high glycemic indexes that increase your insulin, and high insulin spikes could cause like oil gland secretion and acne issues there. So healthy diet is a big role here.
So they say you are what you eat.
Absolutely.
Hey, so we had a segment on earlier with canned fish and that sort of thing,
Yeah.
which, fish would be good, but then some of that, the way they pack it, is very oily.
Yeah.
If you consume a lot of oil, does that have an effect on your skin?
Not too big of a deal there, actually. So as long as you're going more for the seafood, I think that's going to offset any excess oil in your diet, actually.
Yeah. Does lifestyle have a lot to do with your skin also?
Yeah, absolutely. Lifestyle, something as simple as makeup actually is a big deal. So there's so many makeups out there on the market, and the key is I tell my patients all the time to look for makeups that have the buzzword non-comedogenic, which basically means non-acne causing. Those companies have to do extra research to show that it doesn't clog your pores. So that could be a simple trick for females out there.
So where do you find that? Is it in the fine print on the back?
It'll be on the fine print on the label. Yeah.
So you should probably read everything you do. Then,
read what you're doing for sure, and then going with the makeup theme, just like being cognizant of cleaning brushes, cleaning sponges, things like that could be a big deal. And it's something as simple as not sleeping with makeup too.
Yeah. Well, I notice here at Fox 8, we have people that are on television a lot, so they put makeup on a lot. And some of them, they walk around with something that looks like a rusty piece of steel wool, putting makeup on like days in a row. Can that cause a problem for you?
Sure, you definitely want to make sure that it's clean. You're not using that, are you?
No, I don't use makeup because I'm still so young and beautiful.
I was going to say, I don't think you need it. I think you're good.
How about, I know some people, I remember when I was younger, some people, they fall asleep with their makeup on. Is that a big problem?
Yeah, that could definitely clog your pores and lead to acne breakouts the next day. And then another big trigger is stress. So our stress hormone, cortisol, could definitely cause issues like with your oil glands and lead to more acne production too. So being cognizant of getting full nights of sleep, drinking water, exercising, very simple things that can help your skin.
So you get fixated on this thing, you're doing all the right things, and then the day starts to end, you clean up your makeup, and then you use 15 different things to clean up your skin and take care of your skin. Yeah. Can that cause a problem too?
Absolutely. I tell patients all the time, you don't want to turn your skin into a chemistry experiment. So simplicity is the key with this. Trying to be simple and consistent with 1 or 2 products, I think, goes much further than trying to throw 15 on there and whatever the latest TikTok trend is. Yeah.
So going all the way back to when you were a kid, you had acne and you wanted to get rid of it, and you wanted to have better skin. Is there a baseline start? Like somebody's watching out there right now, they keep having these skin problems that keep happening over and over again. Should they come see you so you can tell them exactly what's going on with their skin to get a baseline?
I always recommend seeing a dermatologist sooner than later because acne could become more and more a big deal and could even lead to scarring. So it's something that I would rather see and treat earlier on.
Yeah. Sometimes people don't have acne problems with their face, but they have it on their body, like their back. I see a lot of athletes have that.
Absolutely,
yeah. So how can athletes avoid that problem?
So there's a lot of good topical prescriptions that we use for patients like that, but then being really cognizant of washing right after working out, using clean towels, things like that too.
And when you get acne, is it like an infection? Do they call it like an infection?
It's a complicated disease, so Bacteria definitely plays a role in what's going on, but it also, the way that our skin turns over plays a role too. The inflammation of the oil gland plays a role too. So it's a multifactorial disorder.
So what if you're in Brecksville or Independence or Parma and you need to go to Optima? Where do I go?
Well, it's really exciting because in July, that was a really good lead-in, by the way.
Oh, thank you.
In July, we're actually opening a new office in Independence at the Rockside Medical Building there.
So that's great. It's easy to do. And if you want to make an appointment, do you have to make an appointment like 3 months in advance, or how do you call and what do you say?
So you could go to our Optima Dermatology website, and typically we could get patients in right away. The goal is to try to get people in same day or even next day.
Yeah, and that's important. So that way you can work it out. And what are the hours? Are there any hours that go into the early evening?
We do, yeah. So most of our offices are going to start around 7 a.m. and go to 6 p.m. actually.
So there's some great news for you. So no reason not to go, not to stop by. And you see the doc here, and you'll have this beautiful skin like he has.
Thank you.
Nice to see you.
Nice to see you.